I'm Ryan Duffy. I'm an orthopedic trauma surgeon. College at Dartmouth College, just up the road, which was a great place to learn. And then I subsequently went back and did medical school at Drexel University in Philadelphia, and did my resident internship and residency training at University of Vermont in Burlington, Vermont. And then I did a fellowship in orthopedic trauma at UCSF, University of California, San Francisco, at San Francisco General Hospital. Actually, in medical school was my third-year rotation in Pittsburgh. It was an away rotation, and I saw a total knee replacement, which I thought was amazing. And then you talk to the patient, and they were, the next day just so much better than what they were, and it really changed their life. And that was something kind of functional. I like working with my hands that you could do and make a huge impact on somebody's life. Most interesting thing about my specialty is really the variety and complexity of it. Treating breaks all over the body, simple, complex, different patients, different ages. Every person and every patient and every fracture is different. There's, and you never know each day. You think something that is going to be routine is not, and something that's going to be complex is less so. So it's the kind of the balance between art and science. I think it's important that I'm honest with patients and patients are honest with me, and I don't sugarcoat things, and I don't expect patients to sugarcoat things with me. You want to be honest, and we've got a problem, and we try and work together to find the solution that's going to be best for the patient. I like to stay up to date with especially with some of the latest and greatest things. One is talking with colleagues, both past mentors from residency and fellowship, and other colleagues at different institutions. I'd previously been in a couple of academic institutions, so I try and stay up to date with the latest, as well as attend conferences, reading journals, and finding how other surgeons are treating similar problems elsewhere, and see if we can apply those techniques and get those similar outcomes here. So there are a lot of things that make this job rewarding. Just today I was in the office seeing patients all day, and just seeing people along the process from when they fell, and I deal orthopedic trauma, so a lot of fractures, they fell and broke, and maybe it's, they broke their leg and the other leg and the arm, or just, one ankle. So seeing them from when it first happens and they're in a lot of pain, kind of no idea what's going on, to 3 or 6 months later, and they're back doing the things they love and trying to say, well, geez, how can I get back? Can I ski this year? And so seeing people get through a tough injury and a tough recovery and rehabilitation, and be back doing the things they want to do, and coming in with a smile on their face saying, hey, I'm great, doc, and hopefully I don't see you again. I like to get outside, obviously spending time with my family. But I enjoy hiking, skiing, biking, good food, getting some of all the local farm produce, and our meager garden that we're working on.